Hello everyone, welcome back to the channel. In today's video, we are going to discuss one of the most important and confusing topic of anatomy, that is the nerve supply of upper limb. I'm going to keep it simple, visual and easy to understand. Let's get started with the brachial plexus, the quick overview. All the major nerves of the upper limbs come from the brachial plexus. The spinal roots from C5 to T1, C5, C6, C7, C8 and T1. They together form the brachial plexus. You don't need to memorize the whole pattern of brachial plexus right now. Just focus on major 5 nerves, terminal endings of the brachial plexus. That is the radial nerve, ulnar nerve, median nerve and the musculocutaneous and axillary nerve. These 5 nerves supplies all the major muscles and skin of upper limb. Let's discuss musculocutaneous nerve. This is the nerve which supplies mainly the anterior compartment of the arm, in which the motor supplies includes the muscles biceps brachii, brachialis and coracobrachialis. The sensory supply of this musculocutaneous nerves include the lateral compartment of the forearm, and the roots which are comprising the musculocutaneous nerves are C5, C6 and C7. Axillary nerve. Its roots include C5 and C6. This nerve branches off early in the axilla. The motor supply of axillary nerve includes the deltoid and teres minor. This nerve helps in the shoulder abduction, that is this movement of our shoulder, and the external rotation, that is this movement of our shoulder. So, and the sensory supply of the axillary nerve includes the regimental badge area, that is the lateral part in the shoulder, this area. Medial nerve. It is the most largest nerve of the upper limb. Its nerve root includes C5, C6, C7, C8 and T1. The motor supply of radial nerve, it innervates all the extensor muscles of arm and forearm. The sensory supply of radial nerve includes the posterior arm, posterior forearm and the dorsum of our hand, that is this orange colored part, the lateral side of the dorsum of our hand. I have specially done this coloring for you to understand the things better. Now let's discuss the median nerve. Its roots include C5, C6, C7, C8 and T1. It is the most clinically important nerve. For the motor supply, it supplies the most of the extensor muscles of the forearm, and in the hand it gives its recurrent branch. It branches as recurrent branch and supplies the lobe muscles. For L, it stands for first and second lumbricals. For O, opponens pollicis, and A, abductor pollicis brevis, and for F, it stands the flexor pollicis brevis. And the sensory supply of the median nerve includes the lateral 3.5 fingers of our palmar aspect, and the lateral palmar side, the red colored part, is supplied by the median nerve. And for the dorsum of our hand, the nail beds, the red colored part, is supplied by the median nerve. The nail beds of the same fingers as of palmar hand. Ulnar nerve. Its nerve roots include C8 and T1. It is known as musician nerve because it helps in controlling fine movements. Its motor supplies includes the flexor carpi ulnaris of the forearm and the medial part of the flexor digitorum profundus. In hand, it supplies the interossei, third and fourth lumbricals, are intrinsic hand muscle, hypothenar muscles. The muscles that helps in adduction, abduction and gripping movements of the hand. The sensory supply of the ulnar nerve includes the medial 1.5 of the finger and the palmar and dorsal aspect of the hand. So if you understood the upper limb nerve supply, so don't forget to like, share and subscribe and forward in your study groups. Thank you.